Hello, everyone. Hello, Anna and Roman. Thank you for taking your time joining this Zoom meeting. And this video meeting is very important for me personally to learn more about neurological rehabilitation and how Rehaklinik Zihlschlacht in Switzerland helps patients to recover from neurological conditions. So many patients around the world and families sent me a list of questions which they are most concerning about neurological rehabilitation process in your clinic, recovery time, success rates, and etc. So I have received a list of these questions and we will go through the most common ones. But before starting, I kindly ask you to introduce yourself so people can know you.
Thank you very much, Siba. Thank you for having us. So we are, myself, I'm Roman, this is Anna. We represent the Rehabilitation Zihlschlacht, the largest neuro rehabilitation center here in Switzerland, and for sure one of the most prominent in Europe. We welcome patients for 36 years, although the clinic is older, 100 years old, but evolved into this neuro rehabilitation part. I think we will dive in deeper into the different types of medical fields later on in the discussion.
Also, thank you from my side for the invitation. It is really great to have this opportunity now to explain this topic that's a little bit more complicated and deeper, I would say. So it's great to have the opportunity here to discuss that.
Great. So let's get started from first question. The question is, what is neurological rehabilitation and what types of patients can benefit from it?
So neurological rehabilitation in general has to do with everything with the brain, the nervous systems, let's say the spine, every disease or injury that is around those part of the body, to say. And the idea is, as we call it, bring you back to what you love to do, is to rehabilitate the patient as fast and far as possible in order that he can go back to his normal life. Typical injuries or incidents we treat are actually stroke patients. This is maybe 50% suffer from a stroke, but also car injuries or sport injuries where you injured your spine or have another related injury. We also treat neurodegenerative diseases like Parkinson, MS, or Guillain-Barré syndrome, and ALS, for instance.
Great. So which neurological conditions are most commonly treated in Rehaklinik Zihlschlacht?
I think I mentioned this before, or we touched it a bit. It's actually by far the most common of stroke patients. This is about 50 to 60% of our patients are stroke related. It has a lot to do with the demographics in many parts of the world. People are getting older, they live longer. The lifestyle to some extent is not so good for that extent. So you see more and more patients that suffer from stroke.
Good. How does neurological rehabilitation help patients regain function and independence?
So the key word in neurorehabilitation is actually repetition. So this is how the brain learns and works and should relearn after an incident. Is if you, for instance, suffer from a stroke and you have a paralyzed left upper part where you cannot move your arm, if you don't do anything in order to regain strength and movement, the brain tends to forget that you actually can move your arm, and you will be paralyzed, well, for the time being. And we work with robotic devices very strongly in order to regain the strength and the movement. And the keyword, as I've mentioned, is repetition. So you have to repeat different movements and repeat it for quite a while in order that the brain can relearn in order to move again. But again, neurological conditions are not only about the movement, it's also about cognitive impairments. Some people, they have problem with vision, they have problem with urology related issues, and all of them we actually can treat in a holistic approach in our clinic.
Perfect. Next question, how is a personalized treatment plan created for each patient in Rehaklinik?
If you start from the beginning, there is, if you receive like a patient or the medical records of a patient, our specialists, our senior physicians are going through the medical records. We follow up with the patient, or even schedule like a video conference with the patient in order to have a very good view and an assessment of the current status. And as a result of this assessment, we will actually produce a weekly therapy schedule, which consists of 4 to 6 therapies per day, from Monday to Friday, and even on a Saturday, like 2 to 4. So it's a very intensive program usually. In this program, it's important to know that it's not the same during the whole stay. We will evaluate the current status of the patients on a weekly basis and adapt the therapy schedule.
And that's why your question also is very precise, right? So especially this personalized treatment is so important to really get the best of the patient. So it's not just about having a treatment, it's about the right treatment and having an individual treatment. Yeah.
Perfect. The next question, does the clinic use advanced technology or robotic assisted therapy for rehabilitation?
Very good question. Yeah, we work with robotic devices we actually pioneered it. So we have them for 15 years already. So we even developed or co-developed robotic devices for rehabilitation or neurorehabilitation purposes. So at the moment, robotic devices, they're, well, so to say, mainstream. So, well, many good centers have them. So we even go a step further now and actually focus on brain health. So we just put up an initiative on neuromodulation, where we stimulated the brain with different methods, which is magnetic or directly with electrodes. This is something rather new we put into our therapy schedule. And we also work with partners, university partners here in Switzerland, in order to come up with new solutions for a better rehabilitation.
Good. Next question, how do you monitor a patient's progress during their rehabilitation?
Yes. As I mentioned, it's a very multidisciplinary team we have here at the Rehaklinik Zihlschlacht. It's not only therapy or a therapist, it's not only medical, it's the whole team that makes the difference. And it's also the whole team that monitors, so to say, the progress of the patient. This means that we have on a weekly basis, all of the specialists are getting together and assess the patient's ability at the current status, and as a result of that, we actually adapt the further treatment or therapy schedule out of this.
Good. What are the success rates of neurological rehabilitation at Rehaklinik Zihlschlacht?
Of course, this question, it always depends, right? So important is that you set realistic goals of the rehabilitation. So, for instance, you cannot set as a goal to walk again if you suffer from a full-blown paralysis at the backbone, for instance. So you need to have a realistic goal in order that you can say, okay, I reached my goal. And if you set realistic goals, we reach 94% of this. Wow. Of these goals.
This is like a record.
And this figure, this 94, and this figure, of course, also depends on the motivation of the patient. It's not only that the patient can come to us and say, okay, now make me healthy again. So actually, rehabilitation also requires motivation and work from the patient itself.
So maybe for your understanding, these goals we set with the patients, these goals are, for example, mobility, cognitive functions, to be better in that, quality of life. So these are really several opportunities there where we set goals with them to find the best solution for the patient and a realistic solution.
Can I ask you, each of you, to share one patient success story and testimonial?
Yeah, of course. So we produced several video testimonials actually, which you can find on our website. Yes. One story in particular was the one of an Egyptian patient, stroke patient. He had a stroke in Cairo. I think it was 3 years ago. And the family decided that he will be airlifted to London at that time. And usually, if you have a stroke, you should start rehabilitation as soon as possible after the incident. So they took the decision first hand to bring him to London. In London, the family found out that he was not well treated, so it was not in no means an intensive program. So they were looking for another clinic, and they found us. So we helped them to bring the husband, to us as fast as possible after that, to a very intensive program. He stayed 2 months with us, and he recovered to the extent that he can walk again. He can sustain himself. He can eat. He can drink. So it was actually a very good success story, given that he has lost almost 1 month in treatment, going to a center which was not well equipped for such a patient, and given his age also, because there are many factors that actually have to be factored. But it was a very, very nice story, very touching story, and we are still in touch with them. This is also part of what we do in the clinic. So we are not just cure the people and send them home, we also try to be in touch in order to help them in the daily life as well.
Good. Anna, can you share one more, especially the patient after having car accident?
You mean after having car accident?
Yes.
So we really have like different videos. So you just mentioned the videos we have, or
I will attach in the video,
experience stories. So there's another example also from a nice lady who's also sharing her story, and that's a little bit more specific case, a long COVID case, for example, and that's also something you can find on our website. So they're really different nice and emotional videos. It's always, it gives you a better overview if you really see what the patient is saying about the clinic, about their recovery. So that's deeper, I think, than what we can say right now. Yeah.
Perfect. So what factors influence how much recovery a patient can achieve?
So can you come again? I did not get the question.
What factors influence how much recovery a patient can achieve?
So important factor is time, of course. As I mentioned before, for stroke patients, you really need to do rehabilitation as fast as possible. So this is also an aim from us, that we bring rehabilitation as close, let's say, to the incident on a time basis, also on a medical basis as possible. So we even started on the ICU phase, where the patient is still ventilated. And of course, other factors like health. So if you're obese, overweight, if you're a smoker, if you're, not so fit in a general sense, it can affect the outcome, of course. Also the age is an issue. But again, it's not something that we would say, okay, don't do a rehabilitation if you're 90 years old. it's also always a matter of realistic goal settings, because the goals for a 90-year-old are for sure different than for a 30-year-old that suffer from the same conditions.
Good. Is neurological relaxation effective for patients with long-term neurological damage, especially patients who had surgery even?
Absolutely, absolutely. Especially, especially after surgery, if you had spine surgery or any other kind of surgery, it's important that you do proper rehabilitation, because it will help you to recover faster, and actually also to recover to the same quality of life you had before. It's part. So this is one thing. On, let's say, the more injury-based or incident-based conditions, what you also see are cases like Parkinson, multiple sclerosis, or other neurodegenerative conditions. In that case, the disease is progressing. So it might look different every second, every third year, every fifth year, depends a bit on the patient. So you need to do frequent rehabilitation in order to adapt to the new circumstances you might face with your current condition.
Okay. What is the minimum and maximum length of stay at Rehaklinik Zihlschlacht?
At that point, I would like to take over. So the length can vary. So that's depending on different factors. What we see as a minimum to really make improvement is 3 weeks to stay at our clinic. And our patients stay for 2 to 3 months on average. Where there are always patients who want to extend their stay, and that's fine for us, of course, if we see improvement. So that's important.
Good. How you determine how long patient needs to stay?
That's an important decision we make in advance at first. So what we need for that are the 2 factors. Are the condition of the patients. We already talked a lot about that is definitely an important factor. And the second is the goals we're setting with the patient. So these 2 factors are the most important to really make the decision for how long the patients should stay. And then in the end, we will always adjust when we see, okay, it's going a little slower or a little faster. Of course, we're always happy if we really see fast progress.
Perfect. And what facilities, accommodations are available for international patients and their families? Most common question I have.
Okay, interesting. So we really offer comfortable private rooms for our patients, and they have different sizes. And each private room has the option also to, so the patient has the option to share the room with the family member or a guest. So that's definitely possible. And additionally, we also offer other accommodations for family members, but that's something that our international office will then discuss with the patients or their family members and find the best solution and make travel arrangements with them. So we really want to have the patient focusing on the treatment, on their recovery, and not on organizing things like travel arrangements. So we're trying to take care of that.
Good. What medical records international patients need to send before coming for treatment?
Yes, the medical history is important. So then we know what other doctors are saying about the conditions and so on. Of course, we also try or like to talk to the patient in advance, but the medical history. And the second thing is, if possible, the current medication details, if they are available.
And short video also, if it's can patients send their short videos, their current.
Sure, that's great. So that's really something that helps us, pictures, videos, if if they're able to do that, then it's really, we really welcome that.
Good.
Yes,
Is
and that allows us
translation
to prepare their treatment.
good. Is translation support available for patients who do not speak German?
Yes, of course. So our staff already speaks several languages, but we also provided
Can you
a
mention some
translation
of them?
service.
Which languages your staff speaks mostly?
I think there's not one we can't. So our staff speaks Russian. So we have doctors that speaks Russian. Our colleagues, so they're good in Italian, for example, also in other languages. But as I said, or as I wanted to say, we really provide also translation service, and we don't want to have language as a barrier for the treatment. So we can basically provide every language as an external service. Yeah.
Maybe to add here, language is part of the culture, right? So we also receive Arabic patients from the GCC countries, and in general it's important that we also adapt a bit to the cultural customs they have, and because at the end they are guests in our clinic, and our staff make sure that they feel like at home, so to say.
Good. What visa or travel support is available for international patients coming to Switzerland, to Rehaklinik?
Yes, so we as a clinic, we assist with visa applications, and we also offer this comprehensive support with travel arrangements, as I said before. So it's really important for us that the patient and the guest, that they're smoothly that they have a smoothly transition to Switzerland. Yes.
In general, Switzerland is part of the Schengen area. So if the patient needs a Schengen visa, this is valid for 90 days. If the patient needs to stay longer, we make sure he gets a right or the correct title in order to remain in Switzerland for the treatment, together with one of his or her relatives, of course.
Good. So the next most common question: what is the approximate cost of neurological rehabilitation and Rehaklinik Zihlschlacht?
That's depending on the treatment and the needs of the patient. So we really provide a customized treatment plan, and we can offer a detailed pricing upon request to really ensure this transparency. But to give you a range, because as I said, it's such an important question, or such a common question, a range is in Swiss francs, it would be 2,200 to 3,300. So that means in euro, it is 2,300 to 3,500, and all that per day. Yes.
But including food and stay also?
Yes.
So it basically includes all the therapies, the in-house medical staff. So this means nursing, physician attention 24/7, all food, it's full board. It also includes medication to up to 100 euros a day. So the patient doesn't need to bring medication, and laundry services and so on is also included. And even one additional person in the same room.
Wow, that's perfect.
So what you also mentioned, I think that's also not, so that's also quite important. We also have the a la carte restaurant, so where you can really pick what you want to eat. So we have these cultural differences, and it's important there that our patient and guests, that they can pick what they like.
What happens after a patient completes their rehabilitation program?
Yes, so during the rehabilitation program, we are looking at the progresses the patient is making, and we're monitoring that. So, and if we think, okay, an extension would be necessary, of course, we discuss that with the patient. But if the patient has really completed the rehabilitation, then it is typically like that they will use the support of our international office and go back home to their home country. And there we also provide help in ordering medical equipment, or the patient can use at home. So We can also provide help in that.
Good. And last question, how can patients continue their recovery once they return home?
Yes, they can do that by us providing the individual home-based rehabilitation plans. So there are exercises and guidelines the patient can also follow at home independently. And additionally, we provide also aftercare service. So they can also call our doctors so we can make appointments. That the patient is calling our doctors from home if they have any other questions or wants to know anything. So that's also possible.
One thing I want to highlight from my experience, for example, I remember my patient, he had rehabilitation in another country, another rehabilitation center, but he spent more than a year in a rehabilitation center, and it wasn't neurological rehabilitation, it was just another accident. But still, the rehabilitation recommends to stay 1 more year. But in compare their prices and your prices, so you need, in your rehabilitation, patient just needs to stay up to 3 months in order to have positive results, even from neurological conditions. And this is very important for patients to know, because the more patients, from my experience, I see that the more patients spend time in clinic, the more sometimes stressed he feels, because he doesn't want to stay at clinic for long periods.
It's also, I think this point is very important, right? So if you spend 1 year in the clinic, the rehabilitation process you get at a level, at the peak somewhere. And after that, it might even go backwards if you stay too long, right? So it's a matter of motivation, as I mentioned before. So we would not recommend this. And this is also something we try to prevent with our very broad therapy opportunities. So it will be diverse, different every day. It will not get boring. And at the same extent, it's very intense. So you need, for the same progress in our clinic compared to others, you need less time because of the intensive training.
That's correct. Thank you, Anna. Thank you, Roman, for sharing your expertise, putting insights into an rehabilitation process in Rehaklinik Switzerland. For all patients and families who will watch this video, we know that neurological rehabilitation process is a challenging process, but we hope that this conversation will help you to know details about the rehabilitation process in Rehaklinik Switzerland. But if you still have any question or need consultation with doctor, just feel free to message in our WhatsApp. And don't forget, we are here supporting you on your health journey. Thank you again, and see you in next session.